if you just look at the drug labels in the USA, like they are filled with warnings about violent behavior. Like for Adderall and Ritalin, there's a whole section in the warnings and precautions about like aggression and hostility. Like if you look at the SSRIs, it clearly says it can make some people more irritable, hostile, and suicidal. If you look at antipsychotics like Abilify, it like lists homicidal ideation as an adverse reaction there. And so that means that all of these things have been seen before. And so the next question people say, well, maybe, these are side effects, but can they actually lead to mass acts of violence? And most people are surprised when I tell them that, yes, it's happened before. And so there was, and it's happened numerous times and it has gone into the court system. There was a really notorious case from the 90s about a gentleman called Don Shell. And he was a guy in Wyoming, and he had been exposed to fluoxetine, which is Prozac, before, and he became agitated on it, and his doctor took him off it. I think he went and saw another doctor a few years later, and they put him on Paxil. This is just like fluoxetine. It's an SSRI, same drug class. And within a week, and so he never should have been put on it before, again, because he had already had that bad reaction. But he gets put on it, and within a week, he kills his wife, he kills his daughter, and he shoots his granddaughter dead as well. And then he kills himself.
Wow.
And so the surviving son-in-law ends up suing SmithKline, which went on to become GSK, over failure to warn. And this goes through a jury trial, and they find the drug manufacturer liable for failure to warn. And so that is a mass shooting and a suicide right there, where the jury has found that if not for the drug, like Don Shell wouldn't have killed his entire family and then himself. And so they appealed it, and the verdict stood. There was also another case called the Joseph Westbecker case, and I think this was in Louisville, Kentucky, and he went into, I think it was a paper mill with a gun shortly after, very similar circumstances, had a bad reaction to an SSRI, was re-exposed when he shouldn't have been, and he carried out a mass shooting there, and he killed several people. There's some interesting history here. This was like a bellwether case because there were many other cases kind of coming together to say that these drugs could have these rare homicidal, like could kind of push people into homicide. And it was actually secretly settled out of court, and they tried to hide it because it was the first case, and that was going to kind of hang a shadow over all the ones that were coming afterwards. Eli Lilly ended up kind of settling it behind the scenes and then pretending that they didn't do it. And so, you can read into the culpability there that went to a settlement. And this has happened again and again and again in many different courts. But, the issue in the US is we don't look at this right now. Like whenever there is a mass shooting, and the person is on psychiatric meds or they're on all these these hormones. That's been another big thing lately. People have been worried about all of the transgender violence going on. We don't look at it at all. And I'm not going to sit here and tell you that all of the mass shootings are because of psychiatric medications. There's clearly social contagion going on.
Some people are evil. Evil is real.
And people just evil.
Evil is real.
We also have a lot of guns in this country. Yeah. And that's the reason why if someone becomes manic or psychotic on this drug, it's pretty easy to grab a gun.
Yeah.
And so it's a complicated issue. But you have to look at the role these are playing, because it actually leads to real changes that can help people. So what would those real changes be? When you get put on a psychiatric medication, it would be a great thing if you had a family member there with you. So you could say, hey, we're putting Zuby on a medication right now. In really rare instances, it might actually make him worse. If you think he's uncharacteristically, becoming more depressed, or maybe he's even looking kind of agitated, can you call me straight away? Because I'd want to see him and I'd want to stop. I don't want to stop that. Doctors would actually start doing proper informed consent about this. They don't talk about these risks with patients frequently.
They don't legally have to. I'm assuming.
Informed consent in the US
the-
is just like it's just essentially fake. Like you can the doctors can just claim that they've done it before. Like you don't have to sign anything. Like the experience of getting an SSRI is typically this. You go and you see the doctor, they go, you have depression, here's the Zoloft. Hey doc, what side effects do I need to worry about? Well, you could get some nausea. You could get, a bit of an upset tummy. Sometimes people feel a little bit irritable, like in the first couple of days, but otherwise they're safe. Hey, if anything happens, just give me a call. You then go and to the CVS or the Walgreens, which is our big box retailers for the meds. They slide a keypad towards you. People usually don't realize what they're signing on that keypad, but it says you've been given a chance to talk to the pharmacist about the side effects of the medications. Most people think it's just like a credit card thing, and then they give you the drug. And so no one's really going through like all of the side effects. And I'd love to talk with you in depth about some of the other ones outside of this. No one's really going through the side effects with you. And if anything ever happens, the doctor says, yeah, I discussed the side effects with them. And no one can really prove it.
Because you signed.
Well, because
you did side saying you had the chance to.
Yeah, you had the chance to talk to the pharmacist, and then they just take the doctor's word for it. But like, listen, these are 15-minute visits. It could take me 15 minutes just to go over the side effects, like of a medication, to give someone proper informed consent. And so there is coming back to the mass shootings, there is a change in the US now where, Bill Lee from the state of Tennessee thankfully passed with bipartisan support at the state level that they're going to investigate the role of psychotropic drugs in mass shootings now. Because most people, they want to sweep this under the rug. Like, because if you could imagine that you're like the surviving family member of someone that just like killed a bunch of people in your town, you are not going to say, hey, maybe it was the drug. The like backlash that you would get from that, they might think like, hey, you're trying to make an excuse for what's happened. And so I also think there is a tremendous amount of pressure that when these things happen, people don't want to ask questions. They want to move on from it like as quickly as possible. But the government actually needs to look into that and hold the line and say, no, we have to ask these questions. Yeah.
I don't know if you know the answer to this question, but do you know my brain is puzzled as to what the mechanism could be that, there is a tablet that someone could take that makes them start ruminating on homicide or suicide. Like, what's the mechanism that even causes that? Like, it seems very left field. It seems very strange that, I don't know, you could give someone a pill and suddenly they start thinking on those things, because I don't get it.
So it can happen in a few different ways, and maybe I'll start with like the more extreme ones, and I'll kind of go down to more subtle. And so at the extreme end, you could just become really paranoid. And so there was a case of a guy called David Carmichael, and he
that rings a bell.
Yeah, he's a Canadian. He's a Canadian guy. Never had any history of violence. Really loving guy. He got put on, I think it was also Paxil. Paxil's a nasty drug. That's a really bad SSRI. He became psychotic, and he started to believe his son, who had a seizure disorder, was going to die and was like going to have all of these problems. And so he actually killed his son by accident when he was in a drug-induced psychosis. So at the far level, you can start to develop these psychotic ideas. My son is going to die. It's going to be really terrible. It's more compassionate for me to put him out of his misery.
Is that just like a chemical change that happens in the brain and it's just not firing correctly?
Yeah, full-on psychosis. Think delirium. Like you're just not even like in the right mind. And that factored into his trial. I mean, he didn't go to prison. Like I think he was in a psych hospital for a couple of years afterwards, but he ended up being released because everyone looked at it and there was like, there's no way this guy did this on purpose. And if you just look at the time course from when he got on the medications, like you can see that.
Yeah.
And so full on mania and psychosis, and that can happen. Like you can trigger like manic episodes and all of that. other things that can happen on these medications is something called, and I'm kind of veering into suicide a little bit here
That's
now
fine.
as well.
It's leading cause of death amongst men in my country.
Yeah, yeah. There's something called akathisia, and this is a state where if you take a medication, you can become incredibly anxious and restless, and people will start to pace around the place. They start to say things like, I want to tear my skin off. I want to like get out of my body. They're so uncomfortable. And people will jump in front of trains because of this. This happened to someone called Stuart Dolan a few years ago in a state of akathisia. He threw himself in front of a train. It was never suicidal to that level before.
Wow.
And some people will even impulsively commit acts of violence towards someone. Imagine being in such an agitated, uncomfortable state, and then someone says something to you that rubs you the wrong way. You can react in a way that's completely out of context. Now, the last mechanism I think of when I think of drug-induced violence and suicide is emotional blunting. And that's kind of like the effect of the medication. Some people are inhibited from doing terrible things like suicidal violence because of the ramifications of that. They think about their families. They think about the impact it would leave on their children or their loved ones. And that fear, if you start to blunt that, if you put someone on like a heavily blunting drug, they don't care about that anymore. And so it can also lower inhibitions and can make people do it. And so that's the way I see violence and suicide happening with these drugs.
Got it. That's really interesting.
Yeah.
Yeah, no, that's really useful.